Well, I mean, obesity, I think, has the same overall health effect as smoking, as far as all the different end organs that it contributes to. In my particular profession, I worry about it, for pregnant women, for gestational diabetes and hypertension and birth trauma and things like that. For my patients who are trying to get pregnant, a body mass index, or which is kind of a metric of obesity, we see a lot more infertility. And in the post-childbearing and postmenopausal women, it increases the risk for, again, cardiovascular disease. The one thing that I think is often doesn't get the same media play, it's almost like it's breast cancer for women and cardiovascular disease for men. No, it's cardiovascular disease for men and cardiovascular disease for women. Then we go to the cancers as far as importance in their incidence. And we also see endometrial cancer is tied very much to obesity because peripheral fat converts women's testosterone into estrogen and then can bombard uterine tissue with extra estrogen in the postmenopausal years. So that's the typical woman we may see a endometrial cancer in. So yeah, it's something I always counsel my patients about. I do a body mass index on everybody who comes in, and now we even do our bone densities in the office, and we have software where we're able to give them body fat analysis. And I think folks, when they have an objective measurement of something, it's something they can work with more than just, gee, I'm overweight. And so we always try to impact that. I always bring up the issue of obesity because it is so prevalent, and you always have to be delicate, but I also try not to avoid the issue with the patients. I think most folks, if you bring it up appropriately, are kind of relieved that you do. And I have 6 sisters, so I've had a lot of practice in dealing with sensitive issues with women. And that's one that they always tell me about. No woman ever wants to be told that they're overweight, which is true, but you also need to bring it up in the context of their health care. Most folks are fine with it.